these regulations are supposed to be there for a purpose, and they're supposed to serve a larger good. And I think a case can be made that while certainly flawed and open to debate in a lot of its aspects, the general direction of these regulations are fairly positive and interestingly enough, solve a number of persistent problems that have really hampered the group health market for many, many years. So I'm not trying to be a Pollyanna. I'm not trying to make a political statement here. I'm just saying if you put the rhetoric aside and just look at this as a plan management question, you come to some very interesting points that I think we can illustrate here. What it does at a general level is it builds regulation, first of all, around the individual. The only way I can make this law make sense is to think about it in terms of me as a human being and other human beings, and then how that plays out in terms of their relationships with employers or providers or whoever it is, that the law deals with all of those different paths that individuals go down. But it is built around the individual. The elimination of pre-existing conditions and lifetime limits were all things that benefit the individual. Many of the definitions we're going to deal with here today about, how do you calculate who's eligible, how do you determine what's the most they should pay. These are all things that are built around thinking about the individual. The other thing that it does is it provides more definition to marketplace products.